My name is Bob Nichols. We welcome everyone to our webinar today. I'm a partner with Bracewell. I'm here with my colleague of 10 years, Amber Dodds. I'm sitting in our Houston office. Amber is in our San Antonio office currently. Amber and I practice labor and employment law. I've done that for 32 years. Amber's done it for 10 years. But what's unusual about Amber and I in our labor and employment section is we are the ones who've had OSHA as a major portion of our practice for a long, long time. I, for instance, have worked on, in 32 years, dozens of fatality cases, unfortunately, and multiple fatality cases. We've worked on many inspections, contested citations before the Occupational Safety and Health Review Commission. We've helped clients with self-auditing, and Amber and I also, year after year, answer daily questions about specific OSHA standards, finding ourselves looking through the Federal Register and interpretation letters, trying to help clients answer tough gray area OSHA compliance questions. So that's the nature of our practice. Amber and I, in particular, during her 10 years with our firm, have worked on major PSM, process safety management cases, LOTO, lockout tagout cases, and permit required confined space cases. Amber in particular has worked on two of the largest confined space OSHA cases we've had. And she's very good, and I've enjoyed working with her over the last 10 years. So we want to talk to you today about what we expect in the next 12 months or so, roughly speaking, from the Occupational Safety and Health Administration and their leadership. When Amber and I were planning for this webinar, we saw this as a post-COVID discussion. It was early summer. We were talking. Deaths were down around 200 a day. Daily cases were falling rapidly. We all thought that this was largely past us, and probably the last piece of OSHA guidance had already been issued, so we wouldn't take up your time with COVID. Well, then along came the Delta variant, and things changed dramatically. For instance, on Memorial Day, we had about 18,000 daily new cases on a 7-day average. By Labor Day, that was 117,000 a day. So for those of you who are math majors, that's more than a 500% increase in new cases. In the last 2 months, we've seen daily deaths go from approximately 200 a day to 1,200 a day, a 600% plus increase. And we've seen indirect and really substantial impacts on our country from this skyrocketing number of cases and deaths. Economic growth, all experts agree, has been dampened in the last 2 months. People with non-COVID related medical conditions have been impacted. Planned surgeries have been canceled. Persons with non-COVID conditions who otherwise would be in ICUs have not been able to occupy an ICU bed because the bed intended for them was filled generally with an unvaccinated COVID patient. So there's been really significant impacts, and we're hopeful that we'll see those cases go down in the coming weeks or months. But this has become a major OSHA issue, in large part because of what President Biden did on September 9, which is having, as he put it, lost patience with unvaccinated Americans and the impact they were having on our economy and our society and our public and occupational health. He announced a 6-point plan, or was what he called a 6-pronged strategy to curtail the level of COVID infections and deaths. We want to talk about, above all else, the element of a 6-point plan that requires all employers with 100 plus employees to ensure their workers are vaccinated or tested weekly. And we'll talk about that in the ETS, the emergency temporary standard that's coming per the president's orders. We're also going to talk, that's really a core OSHA topic because those rules for the 100 plus employers are coming from OSHA through an ETS. But we're also going to briefly touch on what the president had to say about mandatory vaccinations for federal contractors and mandatory vaccinations for healthcare employers, at least those receiving Medicare or Medicaid payments. Amber's going to take a few minutes and explain to you the significance from an OSHA perspective of the recent announcements by the president. I promise you, once Amber is finished, we are going to turn and talk about some non-COVID OSHA developments. Amber?
Thank you, Bob. As Bob indicated, the second prong is premised on OSHA issuing an emergency temporary standard under OSHA Act Section 6C. But let's start by remembering where we currently are. At present, OSHA guidance, most recently reissued on August 13 of 2021, strongly encourages vaccination, but does not require it. This isn't the first time President Biden has discussed an ETS. OSHA was directed in January of 2021 to consider whether an emergency temporary standard was needed related to COVID, and to issue one, if needed, by March 15th. OSHA did not issue an ETS at that time, but instead, in June 2021, issued an ETS specific to healthcare employers only. So let's talk about an ETS and what is needed to support the issuance of such an emergency temporary standard. First, employees must be exposed to a grave danger from exposure to substances or agents determined to be toxic or physically harmful, or from new hazards. And second, the emergency standard is necessary to protect employees from such a danger. Following issuing an emergency temporary standard, OSHA has 6 months to issue a permanent standard, which must follow the usual public comment and rulemaking process. Notably for an ETS, the grave danger and necessary requirements are substantially stricter than what is required for validity of an OSHA standard promulgated through the normal notice and comment process. Under that process, significant risk rather than grave danger, and reasonably necessary or appropriate rather than categorically necessary. Because the underlying standard to support an ETS is so high, OSHA very seldom issues an ETS. The healthcare ETS that I mentioned from June of this year was the first one issued since the early 1980s. Further, successful court challenges to an ETS are not uncommon. For example, OSHA efforts to issue an asbestos emergency temporary standards, the one I just mentioned from the early 80s, was struck down by courts for not meeting the requisite statutory threshold for an ETS. This was not an anomaly. Of the 9 emergency temporary standards issued by OSHA before the pandemic started, courts blocked or stayed 4 of them and partially vacated another. So what about this proposed emergency temporary standard? The outcome of challenges here is uncertain. The likelihood, however, of challenges is high. In fact, governors from states such as Texas, Wyoming, South Dakota, and Georgia have promised challenges. Even unions, such as the American Federation of Government Employees, have expressed real concerns that vaccination or weekly testing is a matter that should be negotiated between employers and their bargaining units, rather than be mandated through an ETS. There are strong arguments that COVID poses a grave danger. As Bob was discussing earlier, this week, Johns Hopkins COVID tracker listed over 660,000 COVID deaths in the United States, which has widely been reported in recent weeks as 1 in 500 Americans. Those sobering numbers certainly support a grave danger finding, but there are arguments to the contrary. For example, the American Hospital Association argued against the healthcare ETS from earlier this year that it did not show there was a grave danger from COVID at the work site, where community transmission of COVID was widespread. In other words, you were more likely to get COVID while shopping at the grocery store than at work. Further, some argue that the regional nature of many COVID spikes demonstrates that COVID does not present the requisite nationwide grave danger for a national ETS. We will see how challenges play out, but we expect they will focus on, among other things, the issue of OSHA requiring individuals to undergo a personal health procedure, something OSHA has not previously ordered, never been ordered a vaccination as part of an emergency or regular standard. Another focus of anticipated challenge is likely the fact that there has not been an emergency temporary standard issued during the 18-month course of the pandemic thus far. Even though OSHA considered an ETS earlier this year and ultimately determined it was not needed at that time. All of that said, it's possible the Biden administration could claim victory in the case of a successful challenge if the ETS achieves a significant increase in vaccinations nationwide prior to that challenge being effective. In addition to and part of whether the ETS will withstand a legal challenge are many unanswered questions about the practical aspects of what the standard may require. Let's talk about some of those key questions. First, how long will it take for OSHA to draft and issue the ETS? Comments by officials have indicated it will take, quote, weeks, perhaps 2 to 4. Notably, it has been reported that OSHA has not been working on an ETS over the past weeks, but instead just learned of the president's intentions a week prior to the September 9th announcement, directing them to issue the ETS. Also, remember that it took OSHA 6 months earlier this year to issue the healthcare ETS in June. Another question is because an ETS is effective on issuance, will OSHA allow employers time after issuance to develop a compliant program? The answer is almost certainly yes, given that failure to allow adequate time for employers to implement the protocols will all but assure court action against the ETS. But how much time is unclear, and it's certainly possible that we could see a focus on certain industries to lead the way in terms of timing. Another question many are asking, who will pay for weekly COVID testing for the unvaccinated employee? OSHA will need to answer that question in the text of the ETS as well. But we know that employees in the lowest paid positions cannot be required to pay for testing if that would take them below the minimum wage. In a September 10 briefing, White House press secretary did not directly answer this question, but she noted that, quote, I would bet most would believe the business would pay for that, end quote. Another question, what kind of COVID test will be acceptable? We'll have to watch for the answer in the text of the ETS, a common refrain you're hearing from me as we await that language. Another key question, what kind of proof must an employer obtain of vaccination or testing from employees? While we wait for the ETS and its language on the specifics there, we can expect that OSHA will want to check employer records of both employee vaccination status and testing to monitor and ensure compliance with the ETS. Also, remember that these records, both vaccination status records and testing records, will be considered confidential medical records for employment law purposes, requiring limited access, typically only those who need to know, and also preventing keeping those records in employee personnel files. The questions continue. Will employees working from home or in an isolated location alone be subject to the requirement? We don't know, but there is a good chance that the ETS will not extend vaccination or testing requirements this far, because doing so would make the rule not reasonably narrow and greatly increase the risk of a successful court challenge. We haven't listed on this slide many of the big picture questions that employers nationwide may be asking. For example, will the ETS be used by employers as a cover to mandate vaccinations when they previously were hesitant to do so, but desired to do so? Similarly, will the potential burden of mass weekly testing, including cost and administration, result in employers choosing vaccine mandates rather than providing employees with the alternative of weekly testing? Will employees who have stated that they would quit their job rather than be required to be vaccinated by an employer change their tune when faced directly with the question? Or will we see unvaccinated employees respond by becoming vaccinated so that they have started the vaccination process when their employer seeks to implement a mandate or request information about vaccination status? Finally, will the ETS adequately address employer obligations to provide accommodations due to disability or sincerely held religious beliefs? These and many more questions loom as we wait for the issuance of the emergency temporary standard. But many federal contractors and healthcare employers have another prong of President Biden's strategy to consider. President Biden's executive order for federal contractors. This order applies to 4 broad subcategories of federal contracts, including 1, a procurement contract for services, construction, or a real property leasehold interest. 2, a contract for services covered by the Service Contract Act, which is a contract with the federal government or District of Columbia in which the principal purpose of the contract is to furnish services in the United States through use of service employees. 3, a concessions contract, which means a contract granting the right to use federal property or facilities to furnish services, including contracts for providing services to the general public. And 4, a contract in connection with federal property or lands and related to offering services for federal employees, their dependents, or the general public. What we do know about the executive order is that the new clause in federal contracts will require compliance with, quote, all guidance for contractor and subcontractor workplace locations published by the Safer Federal Workforce Task Force. We anticipate task force guidance to be issued by September 24, as required in the executive order. Notably, the executive order is not specific as to what protocols the guidance will include. However, the White House has indicated that the guidance will mirror recent requirements on all federal executive branch workers to be vaccinated, which, unlike the emergency temporary standard we just discussed, did not include an express testing exception. The clause is to be inserted into new contracts, contract extensions and renewals, and options exercised on contracts as of October 15, 2021. This is a quick deadline for the FAR Council to initiate language for the new clause, and we anticipate quite a bit of additional information in the coming weeks for those federal contractors. As to healthcare employers, another prong of President Biden's strategy is that healthcare workers in, quote, most healthcare settings, end quote, that receive Medicare or Medicaid reimbursement must be vaccinated. This is predicted to cover over 17 million healthcare workers in facilities ranging from hospitals, nursing homes, dialysis facilities, ambulatory surgical settings, and home health agencies. It expands to include staff who are not directly involved in patient care and is anticipated to affect approximately 50,000 providers. More information from the White House on the President's 6-pronged strategy is available at the link on the slide, whitehouse.gov/COVID plan. Again, there are a lot of outstanding questions to be answered in the weeks to come regarding the White House's response to COVID-19, but now I'll transition to Bob for another hot topic of the day.
The hot topic at issue is heat illness. Jim Frederick, who is the acting Assistant Secretary of Labor for OSHA, has made clear in speeches this year that the second most pressing policy concern for OSHA, aside from COVID, is the growing concerns about heat illness in workplaces in this country. And so there's a series of developments about heat and heat illnesses we want to talk to you about. First of all, some background. Traditionally, we have regulated threats concerning heat illness in workplaces, or more specifically, OSHA has, through what you all know is the General Duty Clause of the Occupational Safety and Health Act of 1970. In particular, as you know, the General Duty Clause requires all employers provide a work environment quote, free from recognized hazards that are causing or likely to cause death or serious physical harm, close quote. You know that the other key part of OSHA standards, aside from the general duty standard, is specific standards that are created to address specific hazards, again, like energy control, lockout, tagout, confined space, air contaminants, etc. The general duty clause is the catch-all that is used when there is not an applicable specific hazard that's been promulgated by OSHA. And there is, in fact, no OSHA-specific heat illness standard. There's been talk of adopting such a standard at OSHA since the 1970s. Public interest groups beginning in the 1970s have repeatedly filed petitions with OSHA seeking a promulgation of a heat illness standard. OSHA has resisted in large part because of the difficulty associated with regulating heat hazards. The difficulty is that heat hazards in the workplace are affected by so many individual factors: wind speed, humidity, shade, air circulation, etc. The level of exertion that the employees involved are exercising at the time. It's very complicated to come up with anything approaching a one-size-fits-all heat standard. So we've looked to the general duty clause. And there have been, over the years, citations issued by OSHA under the general duty clause for exposing employees to unreasonable risks of heat illness or injury. They're generally cited as serious items. There have been successful willful citations against employers who have failed to pay heed to heat safety in the workplace. But as we'll talk about, the use of the general duty clause has been complicated by recent case authority. And as a result, the Biden administration, through Jim Frederick and OSHA, have finally acquiesced and agreed to pursue a specific heat illness standard. They included that item on their spring agenda for OSHA rulemaking. This represents a big change. As recently as 2012, President Obama and his administration rejected another effort, another petition calling for OSHA to have a heat-specific standard. Again, just recognizing the difficulty involved, and by the way, in no small measure, the strong opposition from industry groups, such as the Associated General Contractors of America, who've called a heat-specific standard unnecessary, unworkable, and impractical, and have called for OSHA to continue to rely on simply the general duty clause. Mr. Frederick, in a speech in June, described the heat concern as follows: illness from exposure to heat is preventable, but every year thousands of workers become sick from occupational heat exposure, and some cases are fatal. OSHA is initiating work to increase the tools available for the agency to address the hazard. And again, specifically, this year they are starting the rulemaking process for a specific heat standard. Bear in mind, on average, it takes 8 years to complete the rulemaking process on a new OSHA standard. And as a result, safety groups, environmental groups, public interest groups are dissatisfied with the use of the traditional rulemaking process to address heat concerns. And in fact, there has been a petition filed in August by more than 100 groups seeking an ETS for heat. The reality is, and even these groups recognize this, OSHA does not have the capacity to pursue an emergency temporary standard on heat when they're doing the same thing on COVID. Moreover, if we think it's a tough hill to climb on a COVID ETS, it's even a much tougher view on heat, in large part because the heat hazard has existed forever. And it's not a new development. It may be increasing as a result of climate change, but it's gradually increasing. So the chances of a successful ETS on heat are very small, in my view. Nonetheless, there is pressure that I think will fail on OSHA to pursue an ETS. I think they will pursue the rulemaking process. I think we will have a heat standard someday, but folks, it'll probably be years before we see it. The reason we're pursuing a specific heat standard, again, is because decisions from the Occupational Safety and Health Review Commission, which adjudicates disputed OSHA citations, both the commission itself and their ALJs, their administrative law judges that hear cases initially, has greatly undermined the ability of OSHA to use the general duty clause to address heat standards. The problem is you need a measuring stick for when a work environment is dangerous because of excessive heat. Traditionally, as we'll discuss, OSHA has used some National Weather Service information that has come under attack from agencies, that has come under attack from ALJs and the commission. But I first of all want to talk about traditionally how these cases have been handled by OSHA, these general duty clause heat cases. For a long time, OSHA was successful in pursuing general duty clause heat cases. Look, for example, at the post-Buckley case here, where the commission indicated, the commission ALJ indicated, quote, there's no specific OSHA standard addressing exposure to excessive levels of heat. OSHA consequently cited the alleged violation in that case under the general duty clause. And in fact, the commission upheld a serious violation for excessive heat. And the consequences can be even more serious. You see in 2014, the Postal Service had a willful violation that they received and was sustained by the commission. And by the way, how it became a willful violation is the Postal Service was foolish enough to have internal communications that indicated, in essence, we don't care how hot it gets. That is not an excuse for diminished performance. And the commission used statements like that as a basis for concluding that the heat violations at issue in that 2004 Postal Service case were willful violations. So what's happened to undermine the use of the general duty clause? Some of you may have read about the Sturgill case from 2019, where the commission, the full commission, now controlled by Trump appointees, held that the National Weather Service heat advisory charts that have traditionally been used as a measuring stick for determining when there is an unreasonable heat hazard in the workplace were not a legitimate basis for establishing the existence of a hazard. The Sturgill case was followed up in 2020 by a series of ALJ decisions by an ALJ named Judge Calhoun, who specifically held that the problem with the National Weather Service charts is there's no proof from any expert that they had been established based upon true scientific data. And therefore, they represented an illegitimate basis to establish the existence of a hazard. And as many of you know, without a hazard, you can't have an OSHA violation, most certainly not a general duty clause violation. In light of the Sturgill case and the Postal Service cases from the last 3 years, the safety community, safety advocates are very concerned about the ability to use the general duty clause in a successful manner to regulate excessive heat in the workplace. And that led, as we turn to the next slide, to several things. First of all, the August 4 petition I mentioned from the 110 safety, environmental, and public interest organizations calling for an ETS. And that also certainly contributed to the decision of OSHA and Mr. Frederick to pursue the traditional rulemaking process for a heat standard. Again, we are not, I don't think, going to see a heat ETS effort by the administration, both because it would almost certainly fail because of the nature of the danger involved with heat, and because it simply doesn't have the resources to pursue a COVID ETS and a heat ETS at the same time. We are going to see the rulemaking process proceed, and probably someday we will live to see an OSHA-specific heat standard. By the way, members of Congress impatient with OSHA's action, specifically a group of about 70 Democrats in the House, have introduced a bill called the Heat Illness and Fatality Prevention Act, which would force OSHA to pursue an interim rule that's something different than an ETS, but takes longer than a traditional rule to promulgate. There's not much point in spending a lot of energy talking about that proposed legislation because it is widely recognized that they will never get 10 Republican votes of the Senate to support that legislation, and therefore it's never going to pass. So what we're looking at is the rulemaking process proceeding traditionally through OSHA, and someday we'll have a heat standard, but we won't have it anytime soon. By the way, what does that mean in the near term? I think there will be efforts by OSHA and their lawyers to find arguments to overcome the difficulties caused by using the general duty clause as a result of the Sturgill and the Postal Service cases. I want to turn now to the issue of California. As the federal OSHA has dragged their feet, as some would claim, on regulating heat illnesses and injuries, states have moved forward. And I want Amber to talk to you about what California has done.
Thanks, Bob. As Bob indicated, in the absence of a nationwide federal OSHA standard, states are moving forward with heat standards. California, one of the earliest. After more than 13 outdoor employment heat-related deaths in 2005, Cal OSHA implemented a permanent heat illness prevention standard. This standard remains a focus for Cal OSHA today, with the agency issuing a reminder to employers of the heat illness prevention regulations earlier this year at the end of May, just as the summer began to heat up. The California Outdoor Heat Standard applies to all outdoor places of employment. In addition, there are some industries that are subject to additional requirements in high heat, which is temperatures that equal or exceed 95 degrees Fahrenheit. These include agriculture, construction, landscaping, oil and gas extraction, and transportation and delivery of agricultural products and of construction or other heavy materials. As part of the standard, California requires a written heat illness prevention plan that includes 10 elements. The requirements are extensive and specific, so I can't review all of them here during our webinar, but they are available on Cal OSHA's webpage. At a high level, the written heat illness prevention plan must include procedures for providing sufficient water that is fresh, pure, suitably cool, and free to employees. The plan must include procedures for providing access to shade. Shade must be provided if the temperature exceeds 80 degrees and must be sufficient to accommodate all employees who may be on break at the same time. If shade is not an option, alternative cooling measures such as air conditioning, misting machines, cooling vests, water-cooled garments, and portable cooling devices may be used. The plan must include high heat procedures for workdays in which the temperature will reach 95 degrees or more. Must include emergency response procedures, such as appropriate first aid or emergency response for employees who exhibit signs or report symptoms of heat illness. The procedure should designate individuals responsible for calling for emergency services if needed. The plan must also include provisions for acclimatization methods and procedures, which generally require a 4 to 14-day period of regular work in at least 2 hours of the heat. Further, employees must be closely observed by supervisors during a heat wave, which is defined as any day in which the high temperature is either 80 or more degrees or at least 10 degrees higher than the preceding 5 days. The written plan must be available to employees at each worksite, both in English and the language understood by a majority of the employees at that worksite. The plan must also be provided to Cal OSHA representatives if requested. For you California employers, the plan may be integrated into your required California Injury and Illness Prevention Program. To summarize the heat standard, California employers are required to train all employees and supervisors about heat illness prevention. This includes the types of heat illness, common signs and symptoms, procedures to respond to heat illness, when to contact emergency services, and how to communicate with emergency responders. The plan must require enough fresh water so that each employee can drink at least 1 quart per hour, that's 4 8-ounce glasses, and encourage employees to do so. Employees should further be encouraged to frequently drink small quantities of water, not to drink other sugary or caffeinated drinks, and to drink water before and after their shift to continue the hydration process. California employers are also required to provide access to shade and encourage employees to take cool down rest periods in the shade for at least 5 minutes, not waiting until they feel sick to do so. As I mentioned, the standard also requires the development and implementation of a compliant written plan. Bob, you have some additional state law examples for us.
Yes. I'd like to talk about Oregon very briefly. Many of you will recall news reports from June that Oregon experienced extraordinary record-setting heat in June. As a result, the governor pursued an ETS under state law, under their state plan agency law. And on July 8, Oregon issued an ETS on heat. It bears some resemblance to the California standard, but has some real differences. It applies both indoor and outdoor, the Oregon standard. It does not apply to incidental exposure. So if someone has less than 15 minutes, for example, in the heat in a 60-minute period, they're not covered by the standard. The standard is generally triggered by working conditions that involve working in heat of 80 degrees or higher. In that instance, 80 plus, you must provide shade under very specific enumerated conditions. You must provide fresh drinking water for each employee so they can consume at least 32 ounces every hour. And there are training requirements at 80 plus degrees for both employees and supervisors. At 90, additional requirements kick in. You have to have an effective communication program with employees and effective monitoring of employees. The idea is they want supervisors to have eyes on employees to see if they are exhibiting symptoms of heat illness, and if so, to immediately intervene to protect those workers. You have to designate at least one employee who has authority to call emergency medical services at each work site. You must provide at 90 plus degrees a 10-minute break in the shade at least every 2 hours. You have to provide for procedures for employees to acclimate to conditions, which means you could not, for example, take a new employee and have them work at 90 plus degrees in a field or in a construction site or in a warehouse or in a factory all day. You're going to have to ease them in, transition them into those conditions. You also will have to develop an emergency medical plan. Moving on to the next slide, I'd like to talk just very briefly about what other states are doing. Washington State has pursued a similar approach to Oregon. Minnesota has an indoor heat standard that's interesting. It uses sort of a wet bulb system of measuring heat danger. There are other states that are considering standards right now, either regular rulemaking or ETSs. Virginia, Connecticut, Maryland, we should expect more of this. What are the key takeaways? A federal standard is coming, but it's not going to come quickly. It's going to work its way through the regular rulemaking process. There will be more states besides California, Oregon, Washington, and Minnesota that issue state standards under state plan agency laws. Federal OSHA is going under the Biden administration is going to try and find ways to get around the Sturgill and other decisions to make the general duty clause an effective means of dealing with heat hazards again. The public's focus on climate change is driving a lot of this, and it's going to continue to drive it. And you're going to hear about heat risks frequently in the years to come. You know, needless to say, we always, in counseling, clients say that you shouldn't wait for rules. You should address hazards as a matter of best practice. So I would hope for those of you who have employees working in hot conditions, whether they're outdoors or indoors, you've established effective heat mitigation programs. Now let me turn things back to Amber to talk about another key development.
Thank you, Bob. As Bob indicated, a key development here, transportation tank cleaning has become a real OSHA enforcement focus. Transportation tank cleaning provides an all too common tragic scenario in which one worker enters a transportation tank to clean and collapses as a result of asphyxiation or a chemical hazard. A second employee enters to conduct rescue and collapses as well, resulting in the death ultimately of both employees. This tragic scenario often plays out very quickly and among workers who may be longtime colleagues and friends. Most often, asphyxiation is the primary cause of injury and death in transportation tank cleaning incidents, but fires and explosions also occur as well. A couple of specific recent examples in Hugo, Oklahoma, August of last year, there was a rail car tank used to carry gasoline, an incident in which one employee entered and was overcome. A second employee entered to assist and also died in that incident. That resulted in OSHA fines of over $400,000 and allegations of 11 serious violations and 2 willful violations. Another example from less than a month ago in Avondale, Arizona, near Phoenix, in a semi-truck tanker vault incident, similar situation, 2 employees died following exposure to residual sodium hydrosulfide, and in that case, 4 firefighters were injured during response. In addition to the tragedy of fatalities in these situations, significant serious violations and fines, we do also on occasion see criminal charges against employers who have taken actions with just blatant disregard for their employees' safety and or tried to cover up those actions. As a result of this tragic pattern, 2 regional emphasis programs have recently been announced to directly address tank cleaning hazards. The first in July of this year, Region 6, covering Texas, Oklahoma, Louisiana, and Arkansas, announced its program following 165 inspections in the past 5 years that resulted in 318 violations within the region. Just over a week later, on August 2nd, 2021, Region 5, covering Illinois, Ohio, and Wisconsin, also announced its program following 97 incidents in the past 5 years and 23 Chicago area worker deaths in that time frame. If we needed more statistics here, the BLS statistics reveal that tanker truck interiors and confined spaces on vehicles have resulted in 65 fatal occupational injuries. Over half of them was inhalation of a harmful substance, resulting in that worker fatality. The regional emphasis programs provide for both outreach and enforcement activities. Outreach may include letters to employers, training sessions, electronic information sharing, and news releases. Enforcement, to begin 3 months following those outreach activities, includes inspection of operations, working conditions, injury and illness records, health and safety programs, and chemical handling. Under the regional emphasis programs, OSHA will create a list of employers and randomly inspect employers from that list. The single greatest concern here is inadequate confined space safety programs. These transportation tanks often qualify as permit-required confined space based on the substances being transported, the cleaning method used, tank configuration, and other factors. Permit-required confined space standards include very specific rules related to entry, monitoring, and rescue, for good reason given the fatalities we've just discussed. The standards further require training and the use of protected equipment. In addition, the emphasis program identifies other significant elements subject to inspection, such as respiratory protection programs, hazard communication, personal protective equipment, and other hazards indicated by patterns seen in employer records. So the key takeaways here are to recognize the inherent dangers with any tank or other confined space, to maintain the appropriate permit required confined space program, and with respect to those programs, emphasize training, retraining, and auditing. Part of that process should include looking at contractors or subcontractors used for tank cleaning or other confined space work to ensure that the contractor or subcontractor is qualified, maintains the required confined space program, has demonstrated a strong record for safety, and has thoroughly trained its workers assigned to your operations. Don't rely on contractual assurances. Audit these providers and ensure that they are following the same standards and rules as your employees would be. Consider conducting those audits pursuant to the attorney-client privilege to enable you to fully address any issues discovered in that process. Bob will now talk about our next topic, electronic submission of injury and illness data.
Thank you, Amber. This development is relatively straightforward, but significant. As many of you know, in 2016, the Obama administration provided for in a new rule called the Improved Tracking of Workplace Injuries and Illnesses Final Rule, that establishments, not employers, establishments within an employer with 250 more employees would have to electronically submit annually all of their 300 logs, their 301 injury illness forms, their 300A summaries, so that OSHA could more effectively use that data, and researchers who would have access to that could also use that data more effectively. The hope was also, by the way, that if employers had to upload this information, they would feel that maintaining safe programs and addressing concerns is even a more pressing business priority for them, because OSHA will have all that data at their fingertips. So the Trump administration immediately expressed a concern and skepticism about this rule, and finally in February 2019 issued a new rule that provided for only electronic filing of the 300-day summary. By the way, for certain industries with less than 250 employees, but more than 25 employees, the electronic submission rule also applies, as many of you know. Needless to say, the Biden administration has begun to reverse course, and in its spring regulatory agenda indicated that they intend to go back to the original rule requiring electronic submission of also the 300 and 301s in addition to the 300As. Safety groups are not happy because the comments and filings by the Biden administration indicate that this will not happen quickly, but they're moving the rulemaking process forward. And sooner or later, before the end of the Biden administration, we'll be back to the 2016 version of the rule. Before I turn things back to Amber, I want to touch on another significant development, which is Mr. Frederick, in his speeches since becoming the acting head of OSHA, has emphasized that a concern for the current leadership at OSHA is that training is not always being provided to employees. Both oral and written training is not being always provided in a language they understand. And it's long been OSHA's position that training has to be provided in a language that the employees understand, all training and instruction. So if you have employees who don't effectively read, write English, but perhaps effectively read, write in Spanish or another language, that you need to provide the training in a language they understand. A lot of our oil and gas, chemical clients have addressed that issue by effectively saying, for safety reasons, if you're going to work in our plant, you have to speak and write English effectively, because we have warnings, we have manufacturer's information, we have lots of things that are invariably going to be in English. And plus, in an emergency response at our plant, we've got to have everyone able to understand a single language. So they've rationalized and said, look, if you're going to work in our plant, you've got to understand written and spoken English. And but for many industries, that's not something they can accomplish. They do have Spanish language employees, and not just agriculture and construction, but even with a lot of our industrial clients who have plants, what we see is employees are coming in during turnarounds and other maintenance work, contractors, subcontractors. And some of those workers sometimes are not very effective at all with regard to English. So you have to be cognizant of that issue, and you have to make sure that all of your training and all of your instruction, all of your warning signs are in a language that everyone understands. Again, for major industrial clients, that often means we can't have you working in the plant if you don't read and write English effectively, but you have to be cognizant of this issue. Certainly contractors, construction, and again, maintenance work, turnarounds. If you're bringing in workers, temp workers, contract workers, you better make sure that they've received their training and instruction in a language they understand. Now, let me turn things back to Amber to talk about another significant development.
Thank you. As Bob indicated, many of our clues on what OSHA priorities are come from acting OSHA head Jim Frederick's emphasis in speeches. Another emphasis that we have heard from him in a recent speech is on chemical hazards. Recently, he told the audience one priority is to accomplish the goal of reducing worker injuries and illnesses is to focus OSHA's efforts where they can have a big impact, which is reducing exposure to hazardous chemicals. Similarly, Biden OSHA nominee Doug Parker has long emphasized chemical exposure concerns during his career, both at Cal OSHA and in his earlier job positions. He also has previously pushed for tougher standards for certain chemicals, such as lead, while at Cal OSHA. He did work as well with lower permissible exposure limits for some chemicals than exist even under federal OSHA standards. So we encourage you, in light of this push, to be especially vigilant about assuring the levels of air contaminants and other chemical exposures are within OSHA limits. Consider evaluating your engineering and work practice controls to reduce exposure and ensure that you are within those limits. Employers should further ensure that their hazard communication standard provides available and understandable information to employees regarding the identities and hazards of the chemicals that are present in the workplace. This includes labels and safety data sheets. Another focus of the Biden administration is on whistleblowing protections. For example, the current budget calls for 207 new OSHA enforcement employees and 63 new whistleblower investigators in particular. Earlier this year in May, OSHA held a whistleblower stakeholder meeting to address three big questions. First, how can OSHA deliver better whistleblower customer service? Second, what kind of assistance can OSHA provide to help explain the agency's whistleblower laws to employees and employers? And third, what can OSHA do to ensure that workers are protected from retaliation for raising concerns related to the pandemic? Notably, with number 3, as of August 8th of 2021, OSHA has received over 5,550 whistleblower complaints related to COVID-19. So employers should be ready for a far more vigorous OSHA whistleblower enforcement program. And I'll turn it back to Bob with a recent development in this area.
Yes, thank you, Amber. I was struck by a quote I read from Mr. Frederick from August 31, a couple of weeks ago, where he was announcing a very large OSHA retaliation whistleblower award to a couple of railroad workers and who had raised safety concerns and then been fired. This gives you a sense for his view. During that announcement, he had the following to say, quote, "All workers have the right to be safe on the job, and by speaking up, these workers prevented potential harm to themselves and others. Employers that punish workers for speaking out against unsafe or unfair working conditions are breaking the law, and OSHA will hold them accountable, close quote. If that gives you a sense for the flavor of current OSHA views about whistleblowers. Finally, I want to emphasize when we talk about whistleblowers, we're not only talking about people who complain to OSHA, but bear in mind that Section 11C, the Occupational Safety and Health Act retaliation provision, protects employees who complain internally, and relatively informal or oral complaints internally are also protected conduct. So be very careful in how you respond to employee concerns about safety. A couple of closing notes. We really appreciate you joining us today. As it turns out, we're not going to have time to take questions today. However, before you sign off, in the corner of your screen, you'll see a place where you can type in questions or comments. If you have any questions for Amber, please insert them and submit them before you log off. And Amber and I will respond to each question either by email or phone call. Finally, for those of you who are interested in continuing education, this program's already been approved for continuing legal education by the Texas State Bar. For those of you who have other organizations for which you need continuing education credit, we're glad to provide you with a certificate of completion. And we find that many groups, HR groups, accounting groups, occupational safety and health groups, will accept our certification of completion as a basis for continuing education credit. Thank you very much for joining us today. I hope you found this helpful, and go out there and have a good, safe day.